I'm Dr. Dubois. I'm the radiologist in chief at the Cornwall Community Hospital. Three colleagues of mine and myself work out of the radiology team in Cornwall. We work out of the hospital and out of the clinic, the McConnell Clinic. You know, what we do is we do x-rays, ultrasounds, CT scans, and hopefully soon MRI scans. You may be familiar with those. The four colleagues
right out
of mine, the four radiologists that I came from, I wanted to say we provide coverage. We work 365 days a year, 24 hours a day. I just finished working throughout the weekend. I'm here today.
Talk loud, they all looked at me.
We never drop a minute of work. The reason I came tonight to say a few words about radiology and the way it's going to affect you is because I cannot just sit and take the information that comes out of the media, out of the Ministry of Health, when they say that by cutting $1 billion this year alone from the budget, they are not going to affect your services. So I just can't sit and take that and not say anything. I'm here tonight to tell you that yes, you're going to be affected. It is not that long ago, it's about 6 years ago, that I can remember waiting lists for ultrasounds, CT scans were in the months. It was not unusual to hear your CT scan will be in 6 months from now. Your MRI scan, 18 months. Beyond that, it's ridiculous to even talk about it. You know, you cannot wait 2 years for a diagnostic exam. That's 6 years ago. Things improved dramatically since then because of money that was put into the system, basically. And I'm very proud to say that as we speak, no waiting list goes beyond 2 weeks. We provide all the tests within 2 weeks. I feel, yes, thank you. I have to tell you that I go to conferences and meet colleagues from around the world all the time. It used to be a standard joke when we would talk around the table and I would tell them I work in Canada, in Ontario, and our waiting lists are in the months. So, that used to be pretty standard comment to make for a radiologist coming from Canada. And now, lately, I've been very proud to say I can compete with anyone in the world to say within a couple of weeks we can provide our tests. The $1 billion cuts this year translate, to speak about radiology alone, they translate into a 14% cut in the overhead budget that your hospital is going to see this year, 10% cut in the overhead budget that our clinic is going to get. Overhead in radiology means the technologists, the equipment, the renewal, the supplies. That's what it means. If the hospital has 14% less for technologists this year alone, and the government is gleefully saying, you haven't seen anything yet, this is just the opening salvo. If this is the beginning, then pretty soon the 2-week waiting list is not going to be 2 weeks anymore. We're going to return very quickly to the state we were only 6 years ago. I remember that. So I am here to tell you this is what's coming down the pipeline. This is not about to happen. This has happened retroactive to April 1st. They always announce these things effective retroactively to a certain date, April 1st. So this is for the operating budget of the hospital and the clinic. You have nowhere else to go in Cornwall. You have a clinic and a hospital. That's where you get your diagnostic imaging exams. Now, very quickly, I'm going to mention one more thing that I find very troubling about these cuts to our budget. The way they were announced, the way they were done, without really talking to us, basically insulting us, and announcing we have decided $1 billion to go right to cut out of your budget. they have scared, they have put a chill in our brotherhood, basically. In radiology, I can tell you, our own association made a quick survey of 200 residents. These are doctors, they have MD degrees, and they're training for 5 to 7 years to become radiologists. They interviewed, they asked questions from about 200 radiology residents here in Ontario. And they asked them, are you considering, would you stay here in Ontario after you're done? 80% said, I am thinking about not staying in Ontario. I have to tell you, this is chilling because Ontario used to be the #1 province, the go-to province because of technological advances, because of the type, because whatever have you, working conditions. Now, 80% of these residents that are preparing right now to become radiologists are thinking hard about looking for work somewhere else. What does that mean for you within the next 4 years, within the next few years? Is that, well, you know very well, the population is getting older. Our total numbers, the population of Ontario is not decreasing, is increasing. More tests will be needed, not fewer. If more doctors don't become available, more radiologists don't become available, then the waiting lists are going to get longer again. I will stop there. Just think about it. The government is painting this move as a win-win for the population. We cut $1 billion from the medical services. The services remain the same. I don't know how that works, but they're not. Thank you.
I'm Ronald Traldi. I'm a family physician in Cornwall since, been here since 1984. I'd like you to participate a second because I think some of you are falling asleep here. Any of you?
Go up to the sleep clinic.
Dr. Mace will take care of it. Any of you who do not have a family physician here? There's not too many. Most of you are relatively lucky. There's a few, it's very hard to find one. And maybe most of you have one because you may not know it, but most of you are in the age group where they were an agreement with the government and the physician to try to provide more service for the people who are not 20 years old anymore. So this may be, these agreements may be going away with the plan of the Liberal government. So you were kind of lucky for a while because you were in the good group of people that were at the right time, at the right place. Any of you have a family physician that is less than 40 years old? Whoa, there's one. Okay. Keep her or keep him. I think it must be a her. It's a her. Any of you have a family physician that is under 50? And I may look under that, but I'm not. Yeah, there's one. Okay, any of you are having a family physician under 57 years old and you don't, you're not in that group, no. What I'm trying to say is that the physicians are getting older and the physicians that are taking care of you now are getting older. And time, flies, and eventually Dr. Bates will retire, and eventually Dr. Tremblay will slow down, and it's going to happen. And then you need new physicians. You need young physicians to come to Cornwall, and you're going to attract them if you give them conditions that are as good as they can find elsewhere. It's very, very simple. So it's very important for every one of you to get involved in this situation and to let the Liberal government know that it's important for you. Thank you.
I'd like for one of you to explain what delist means because most patients do not know what it is. To delist something from the list of the government, if you could explain that.
To delist means to take it off the payable OHIP fee
And to allow the patient to pay the
and
doctor.
the patient to pay for it. Yes. For example, removing treatment of warts years ago was delisted, but there's a nasty little trick. OHIP doesn't necessarily delist something; they make it a fee of zero. It does that. It's a tricky way to get around preventing alternative payment for it. That's what delist means.
I'd like to add to that further. In ophthalmology, there are certain things that are covered by OHIP and certain things that are not. One of the tests that I mentioned earlier is called an OCT test, and that's the test we do for both glaucoma and macular degeneration. That test used to be not covered by OHIP, so people had to pay a significant amount of money for that test. Anywhere from $150 to $200 was the private fee for that test. Then back in 2008, it became covered under the OHIP fee schedule at a significantly reduced cost. And so doctors were providing that service under that covered cost. Now what they have done is they have reduced that fee to 80%, by 80%. So now that test that used to get paid $150 to $200, we are now going to get paid $12.50 for. I have had many patients ask me, well, can't I pay you the difference? And I said, no, you can't, because extra billing, which is what he means by paid by zero, you can't charge a patient. It's considered illegal. So we can't overcharge. So that's what Dr. Bates is trying to say. We are in this system that we're stuck in. If we want, as a doctor, let's say you are the best doctor in the world and all the patients want to see you. You cannot opt out of OHIP and then charge every patient to come see you. Actually, you could, but you could not charge the patients more than what the fee is that the government's going to pay you. So we have, for example, in ophthalmology, this machine that we pay $90,000 for, and we have to only get $12.50 at the end of the day for doing the test. So as you can see, we are doing these tests at a loss. The zero rated means you can do that procedure or that test on the patient, but you can't charge the patient, nor can you charge the government. So therefore, you have to do it at zero. Anybody in this audience have ever done a paid job for nothing? A paid job, not a voluntary. Okay, well, you're better than most people, I guess.
My name is Ray O'Collins. First of all, thank you for the initiative. And we hope that you people, the OMA, will spread this across the province so that this type of meeting will go on in other areas as well. And that we can get something in concrete settled and we can move on with that for their supply.
Thank you.
Might be a lot, 5 minutes.
3 minutes, Nathan.
My name is DEHR, and I'm a general practitioner. They try to sugarcoat what happened, okay? And what happened is that any profession which works with the government has a contract. Our contract ended at the 31st of March of this year. Now, usually the negotiations start a few months in advance. When the government tried to negotiate, and we cannot say they negotiate, they try to impose their will. They say that's what is going to happen to you guys. Now, what's happening to me is I'm going to have a reduction of about 30 to 40% income. We are 18 doctors, 18 or 17, 18. in the fall. I don't know what you know, if you know what fall means. It's about we have assigned patients. In my case, it's about almost 1,960 patients. Half of it, they are over 65. Now, what happened is that was what they said is not only we're going to cut to 30 to 40%. First of all, I don't understand what the CMA continue to negotiate with them, because there's no negotiations when somebody imposes you something and says that's what we are doing. You have no choice. That is dictatorship, as far as I understand, by Dr. Bates. Now, what they said is we don't know what we're going to cut on you guys, okay? We don't know from what we're going to do, but we will tell you in a while. Now, I don't know what fees are not going to be paid, what fees will be reduced, and that's the state right now. Cornwall has a particular part in this province, and I think this constituency is about, I believe, all of them, they are bordered by Quebec. Now, most, there is a general practice or family physicians, I believe there is about few of us, they come from Quebec. Now, as there is the age group of our whole, I think Dr. Pound is young, almost the
He looks the youngest, but he's not.
Okay, so now, what will you do if somebody tells you, I'm going to cut 40% of your income, and I'm 66, I'm not going to go to private life, okay? I have retired before. I don't think I'll continue. If you don't take this thing to your hand, not only you're going to lose me, okay, you're going to have to look for new physicians. You're going to lose most of the doctors, they're going to retire as early as it's their convenience. You're going to have a crisis in Cornwall. Now, just to give you a little idea, the Pittsburgh Clinic physicians, which they do the walk-ins, okay, almost all of them, they come from Montreal. There is almost, they see over 110 to 140 patients per day. The McConnell walk-in clinic, there's 2 or 3 physicians in it, which they work there every week, okay? They have probably around the same number of patients. Those doctors, they're not going to show up there. Now, on top of it, they mentioned to put a cap. What caps mean is that you're going to have certain amount of income. Above that income, we're going to cut additional than 40% what we are going to cut on you. We're going to cut additional 30, 40, 50%. And we had that before. About 8 years ago, we had that as a system. Doctors could not work because they had to pay over 60% about certain amounts. Now, when you have 35% of expenses, you can go to a certain degree, trying to provide a free care. You will not do that all the time. So basically, that is the situation. I just wanted for you to be aware, and you should take this matter to your own hands. I appreciate, in the meantime, for you to organizing that. We wish, the people in Toronto, they were as kind as you are. Thank you.
Am I right in thinking that you have coaches? That you have made it doesn't give you coaches to do only so many cataracts?
And for cataract surgery, you're asking, does the government give us quotas? They used to. What used to happen was at our hospital, we got a base amount of funding, and that was for 1,300 cataracts per year. Okay, we do a lot of cataracts because a lot of people need cataract surgery. Then what they did was they initiated what is called the wait time initiative to lower wait times. Because when I started here, people were waiting 6 to 9 months for surgery. Now I'm able to do surgery in a month. It's not going to be like that anymore. Because what they've done is we were funded for 1,750 cataracts, They've now reduced it back down to 1320. So I didn't mention that. I'm glad you brought that because I felt I was talking too much. But that was another reason why we're going to see less cataract surgery done because the funding has been reduced quite significantly. And that's another reason we're having difficulty being able to recruit a third ophthalmologist is if we can't provide him enough surgery to do for his patients, they're not going to want to come here. So I'm not sure if that answered your question.
Yes.
Oh.
I just wondered, is it just for the cataracts or is it for the surgery for the torches?
Dr. Cook could answer that.
Okay.
Right now, it's just cataracts and total joints that are handled in that way. But the scary thing is that over the next 3 years, through a major change in the way we fund hospitals now, they're going to be doing what they call quality-based medical procedures, and it's going to expand to fractured hips, other orthopedic surgeries, general surgeries, and even medical procedures. And we are all sort of trying to figure out how the government is going to do this, and I don't quite honestly think they know how they're going to do it. But that is their plan, is to roll this out from just 3 procedures that they're funding this way this year, which is cataracts, total hips, and total knees, to over 30 procedures over the next 3 years. And it seems we're struggling in the senior administration of the hospital to try and understand what this is going to mean for Cornwall. Like how can you possibly say you had 50 broken hips last year, so we're going to pay you for 50 broken hips this year? What happens if there's 60? What happens if there's only 40? You know? So it doesn't make a lot of sense to us, and we're still trying to figure out how the government's going to roll that out. And then if you turn that into something like, because they are planning to do this for things like people who come in with pneumonia or congestive heart failure, how do you figure out what's the right number to pay the hospital for those sort of procedures? And if you'd that year only see 200 people with congestive heart failure, and you're funded for 300, what the government's going to do is claw back the difference for the 100 that you didn't treat. But on the next year, when you might have 400, they're only going to pay you for 300.
I think it does not make any sense that when you save some money, that the government has got the right to give back. Because if you're doing your job, plus you can save some as well, some money, I think that should be acknowledged. Because and it should not be taken away. I mean, it's just like when you're working and we put some money away, and the doctor says, well, we put too much money away, and now they're getting it back.
I agree with you. They're basically trying to, from what I can see as the chief of staff, trying to understand what they're doing, government would like to dictate what your health care is here and control what the physicians and the hospitals are providing for you. They want that control all in Toronto, and I think that's completely wrong. Because anyone who's had an illness knows that they want their doctor, they want the whole care team, the nurses, the hospital, to be focused on them getting better and giving them the best care. And that's not the system the government's setting up right now. They want to tell you from Toronto what we can provide for you here, and they're trying to do that through the fee schedules.
I have a major problem with a government official who is not a medical person deciding my medical care. I want a doctor to decide what care I need, not a government official.
If we carry on the way they're doing now, as far as medical is being dealt with, I think we might as well put out the swastika and the sickle behind it.
May I just add that I did study Marxism-Leninism during at the university level in Hungary, and the definition, a bit of abbreviated definition of socialism is that everybody contributes to society to the best of their abilities, and they are rewarded according to their contribution to society. The definition of communism is that everybody contributes to society according to the best of their abilities, and they are rewarded according to their needs. But who defines what their needs are? Think about it.